Hello, it's Dr. Rhonda Johnson. Today's Tuesday, March 26, 2024. Today I'm talking about ageism. Ageism is the stereotypes around how we think, prejudice, how we feel, and discrimination, how we act towards people or ourselves based upon age. Ageism can reflect everybody. The World Health Organization notes that ageism is everywhere, from our institutions and our relationships to ourselves. Ageism can change the way we view ourselves. Ageism can devalue or limit our ability to benefit from what younger and older populations can contribute. Ageism can impact our health, our longevity, and our well-being. Ageism can have far-reaching economic consequences. In younger people, ageism can increase risky health behaviors such as eating an unhealthy diet, drinking excessively, using substances, sexual risk-taking behaviors, and all of these can reduce the quality of life of younger people. Now, in older people, ageism can lead to policies that support healthcare rationing, for example. And the COVID-19 pandemic really highlighted ageism, as some medical care interventions favored young people, particularly when resources were scarce, like ventilators, etc. So I want to talk about ageism in older adults. Older adults are frequently stereotyped as dependent or frail or out of touch or even a burden. The World Health Organization talks about misconceptions on aging and health, and they note that there is no such thing as a typical older person. In fact, some 80-year-olds have levels of physical and mental capacity that compare favorably with much younger people. But there are also some in their 80s that require extensive care and support for basic activities, such as dressing and eating. So did you know that the physical and social environments in which we live are powerfully influential when it comes to healthy aging? So the World Health Organization notes that one of the key issues affecting older people is social isolation and loneliness. Studies show that 25% of older people worldwide experience social isolation and loneliness. Now, this lack of social connection can have a serious impact on physical and mental health. It can increase the risk of cardiovascular disease, stroke, diabetes, dementia, depression, anxiety, and suicide. People who lack social connection have a 30% higher risk of early death. Now, we really do have to address this issue in a systematic and policy-driven way, but that discussion is the subject of another video, not this one. But on an individual level, folks, we can all show respect to our elders. We can stimulate social contacts for them. We can engage in intergenerational knowledge sharing, and we can promote active living for the older people in our lives. So in closing, I want to share a few facts with you that I found interesting. Astronaut John Glenn returned to space at age 77. The cooking legend Julia Child wrote a cookbook at age 87. One of the most famous architects of all times, Frank Lloyd Wright, was designing homes at age 91. And William Shatner, also known as Captain Kirk of Star Trek fame, went into space at age 90. So that's my message today. I hope it'll generate some thought-provoking moments for everyone who listens. We can all benefit by evaluating ourselves on this ageism topic. That's my message. Take care and be well.